On an average, 1.26 million doses of vaccines are being administered every day in the last week in India. This makes India's vaccination program the second largest in the world after United States. India has tripled its vaccination in the last 20 days, though experts believe that given our population, we need to increase the pace much more. Well, it's National Vaccination Day, and this time around, this year, of course, it's a lot more important because of the pandemic that we have been facing. India now has the second largest vaccination program after the United States. No doubt, India is doing really well, and over 30 lakh vaccinations done in a day. It's the highest. But experts believe that even now there is a need to amp up the vaccination across the country. There are various factors to why it needs to be amped up a lot more in a country like ours. To discuss more on this, joining me now is Dr. Vishal Rao, Senior Oncologist from the HCG Hospitals. Many thanks for joining us. Dr. Vishal, firstly, how do you look at the vaccination program of India as it's going? Of course, in the last 20 days, the number of vaccinations in a day has tripled. But do you see a need for the vaccination pace to pick up a lot more?
Back here in Karnataka, in the state committee, we've often discussed on the aspect of need for ramping up the vaccination outreach. Naturally, the focus of Government of India has been, they've already put up a priority listing, and the first round was healthcare workers. The second round now is the age people 60 plus and the comorbid groups, and thereafter it is going to be the other groups. Which is going to be focused on. Now, the overall aim again of this is that we have a small gap, Pratibha, between the first wave and the second wave. If you see as of today, the numbers we are at, if you take the 7-day average of the new cases per day, it is at about 22,000 pan-India, which is nearly close to what we were in July. So we are at the crest of the second wave. Now we've got a small time gap before we create a fortress around us. Now that fortress comes for working towards herd immunity. And when we say that, the only way we achieve that fortress of herd immunity is through either getting exposed to the virus or to the vaccine.
Absolutely. But, I saw a very scary statistic as well, an expert pointing out that looking at the pace that we are going right now, it could take up to 2 years for the first 4 priority groups to be vaccinated completely. If it's just, for the first 4 groups, it's going to take 2 years. We can only imagine what it's like for the entire population. So, what is an easily achievable target? We have over 2 lakh vaccinators across the country. They're well trained. We have identified groups based on their vulnerability as well. So what is the target that the government needs to aim at to ensure that the pandemic ends as soon as possible?
Again, the overall general formula that we've all been talking about is getting a herd immunity of at least 67%, which is what the public health experts have been talking to us about, that would be the number that we would look at considering the R naught of this virus. Now, considering that till now India has seen about 1 crore infected patients, and we still 120 million across. Thing that we've learned over the last 1 month has been a lot of interesting learnings on how to accelerate this process, and through a large, like a pulse polio kind of a program. And I think the next step that the government is now taking is to ensure that this can be done through vaccination drives, which is mobile. So the mobile vaccination drive is going to be the next phase that we're going to be having to work hard on to ensure that, because right now mobility is the one restricting vaccination, that a person has to come all the way and get vaccinated. So comorbid, people who are ill, serious, these are people who are saying, oh, we are finding it difficult, we have to go proactively and do it. We'll have to take the vaccine to the homes, and that is what polio gave us the victory for, and that's the kind of formula we will need to require and look at in order to penetrate the population.
Okay. But do you also see some, vaccine hesitancy as well, doctor? Because, there are several people now that, senior citizens also are getting, of course, we're seeing huge numbers. It's increasing per day as well. But does the number have to be a lot more? Do you think the government is doing enough to really assure people that vaccines are absolutely safe? a few reports that we've seen in the European countries of a few vaccines being suspended, that has only added to the fear. So, is the government really doing enough to allay any kind of fears among people? Is enough being done on ground to ensure that people come in huge numbers when it's their turn? They just come to the spot to get vaccinated?
And on this regard, I am myself one of those people who was hesitant about the vaccines, I must admit. And I've taken the first jab. Now, when we were in a panel which was conducted by the Rajiv Gandhi University of Health Sciences, the largest healthcare university, along with the WHO and the state government, I was a part of that panel, and I was the only person in the panel among the five who was not vaccinated. And so all eyes were on me to say, what was the hesitancy that you had? And the fundamental thing I said was that while we are running a whole lot of social media campaigns of photographs, selfies, saying I'm vaccinated, I think more amount of the science needs to come out, which is what helped me overcome my hesitancy. The science of it was the one, like the data that is coming out from the large published reputed medical journals globally, the scientific community talking about it, and those are the things that we will need to do rather than just photo op opportunities to show that we are vaccinated.
So that's also, of course, one of the factors that the government needs to look at to ensure that people are absolutely convinced about it. But as far as the vaccine doses are concerned, do we have enough? On one hand, at least on social media, there's a lot of discussion on we need to vaccinate our own people. Why is it that India is exporting the vaccines? This is a debate that has been going on for long. So to hit the target of 5 million per day vaccines to be administered to people, we have to produce 150 million doses of vaccines every month. Is that a possibility right now? And how do you see this vaccine maitri by the government? Is that something that you'd like to comment on?
I'm not an expert at this point in these areas, and my knowledge is less, but what I would generally like to tell you from what I understand currently is that Government of India has also played a larger role to help other countries who are in need. Now, this has both industry and government both role in it. That means the Serum Institute is also playing a larger committed role to the conviction and commitments on the research that they have developed with AstraZeneca, Oxford, and there's a larger complex interplay at hand right now to understand the commitments that they have done during the development phase. So they will need some responsibility that they will need to hold for other countries too. And naturally, India is at a very strategic point because even Covaxin, which has come from India from Bharat Biotech Group, is also got the capability. So naturally, the way I see it, I think no country in this world has done what India has done at this point.
Okay, all right. So lastly, as somebody who has taken the jab himself, Dr. Vishal Rao, you admitted that you also had some hesitancy before that. So as a final word, what's the advice that you would give to the people?
I think the final word because of which I took the vaccine was I now firmly understand that either I face the virus or I face the vaccine. Now, I'd rather face the vaccine. I don't want to face the virus. So let's all understand this, that our immune system needs to be given an introduction to the virus either through the vaccine or through the infection. We would all choose the vaccine and not the infection. So let's not make a pledge today to say that we are going to stop the pandemic at this point and flatten the curve.
Okay, all right. Thank you so much, Dr. Vishal Rao, for joining me with your thoughts on that. Thank you so much.
While India has attained goodwill globally for its supply of vaccines, it's important for people to ensure they take the vaccines and also follow the norms to defeat the pandemic.